In the East Khasi Hills district, the latest disaster management framework prescribing zonation was adopted. Based on existing police jurisdictions, Shillong City was divided into 7 zones, each under a magistrate or incident commander heading an incident response team or IRT. The teams report to the Deputy Commissioner, Chairperson of the DDMA or District Disaster Management Authority via the CEO DDMA and the District Disaster Management Officer. Starting from the March lockdown, the challenges were manifold. The zonation approach helped in tackling many. Disaster management teams, with help from the Home Guard, ensured effective surveillance of returnees. Surveillance enables early identification and isolation of symptomatic cases so officials and health workers could control the situation and prevent community spread. Contact tracing was managed through the zonation communication channels. Updated lists of primary contacts of positive cases in each locality were maintained. Home visits were also arranged to check on the quarantined. Initially, there was major fear and uncertainty amongst the town communities. Turning them into confident stakeholders was crucial. Meetings were held across the zones as communities familiarized themselves with their respective IRTs and incident commanders. At each zone, community COVID management teams or CCMTs were formed, comprising of community representatives, ASHA workers and other residents working hand in hand with the IRTs. CCMTs helped incident commanders keep a close eye on curfew and lockdown compliance. Violations were quickly identified. Relationship between CCMTs and IRTs ensured a quick response when positive cases were identified. Zonation approach had a positive impact on people. Fear was replaced with a collective understanding and yearning to cooperate. Advantages included quick delivery of essentials across the zones, ensuring no one lacked basic supplies. Local sanitization was efficiently tasked. Community quarantine centers for returnees were set up in the zones, managed by communities with IRT support always ready. District administration arranged community mask distributions. The District Commerce and Industry Centre, Red Cross and other concerned organizations contributed. As more cases surfaced, Behavioral Change Management Committee was formed from CCMTs to train communities to take more responsibility in the pandemic fight. This helped the regular citizen understand the different protocols better. Micro-containment areas were created based on areas of positive cases and additional information shared from the zones. Micro-containment areas were effective in curbing spread without bringing the city to a halt. Behavioral change initiatives helped in effective management of these containment areas. In the scenario of COVID-related death, communities were not in fear anymore and cooperated with the protocols for safe and dignified body disposal. Identified contacts from different zones were tested at designated testing centers and hospitals. The Disaster Management Transportation and Accommodation Cells worked in tandem with the zone IRTs. Transportation Cell registers returning residents and provides transportation to quarantine centers. The details of returnees are shared online with IRTs, and communities in respective zones prepare quarantine and monitoring facilities accordingly. Employment details of returnees shared with block counseling centers will be used for future policies. ZONATION enabled easy identification of migrant workers, both inbound and outbound. For many weeks, the stranded outbound migrant workers were cared for in relief camps and eventually were sent to their home districts and states. Corona care centers and institutional quarantine centers house many returnees, augmented by the community centers. The accommodation cell assigns these quarantine centers for returnees. Activity in the district emergency operations centers continues. Control rooms and call centers orchestrate resource mobilization based on zone updates. ZONATION engaged the people and helped roles reverse. Government agencies no longer push initiatives. They are now facilitators as proactive communities take the fight to COVID with behavioral change and protocol compliance. Shillong's residents have realized that change needs to come at the individual level. They are ready to embrace the new normal.